Let us see how many types of movements are possible at elbow joint. Just hold your arm here and move at this point. Now we have flexion, extension, pronation, and supination. Flexion, extension are the only movements that can occur on the elbow joint itself. Do you wonder why? Because this is a hinge joint that can only move in two directions, like this. So you cannot perform adduction and abduction at your elbow joint. Now, let me demonstrate these movements for you. Flexion, it is basically decreasing the angle between two bones. I'm talking about this angle, bending your arm. Now we have extension, which is the opposite of flexion, which is like this, where you increase the angle of the elbow joint. The main joints involved here are the humeroradial and the humeroulnar joint, which are present here. Now, coming to the rotatory motion of the elbow joint. This will result in two motions, the pronation and the supination. The main joints involved in supination and pronation are the proximal and distal radioulnar joint. Remember that I told you before that the proximal radioulnar joint also forms the elbow joint. Supination can also be remembered as the palm faces upward, like it's facing the sun. And pronation can be remembered as watering the plants, because the palm faces downward. As I have already discussed before, the humeroulnar joint, which is a hinge joint, is formed between humerus and ulna, which allows two movements, flexion and extension of the arm. Now coming to the humeroradial joint, which is a ball socket synovial joint and is formed between the humerus and radius and allows movement like flexion, extension, supination and pronation. The third joint is radioulnar joint, which is a pivot type of joint and is formed between ulna and radius and allows rotation of the lower arm, which gives us pronation and supination. As we all know that these movements are not possible without muscle. So let's discuss the muscles in the next section.